All right, so Bio 30S, welcome back. In between last parts, I got a haircut, so you don't have to worry about the hair in my eyes as much as before. We finished off with homeostasis, so we are talking about the various reasons and trying to understand what that whole idea, what that whole concept is. And that's kind of been the theme of our course so far. So when all of your systems, when all of your body systems are working together, they're trying to keep things in check. They're trying to keep things in balance, and that's what we call homeostasis. We're trying to maintain homeostasis. If you're in good health, we like to say that you are in a state of homeostasis. That's because everything is in balance, everything is fairly good. So homeostasis is going to reflect the ability of the body to maintain relative stability. So it's going to see how well your body is able to either function in a normal state or to return to a normal state when there are stresses applied to the body itself. These changes and these stresses, these can happen inside of the body. So things that you can't see, you might be able to feel, but sometimes you can't. Or they could be things that are outside that, whether they're in your control or not, but your body is going to have to respond to those accordingly. That's partly the reason why you can't run for an infinite amount of time because your body doesn't have the energy to keep up with that. Your heart can't pump for that long. Your lungs aren't able to expand and contract as frequently as you need them to. So you need to rest at a certain point. But you can manipulate that. You can change that as you work out more, you exercise more, and your body becomes more accustomed to those motions. Um, and the homeostasis starts to shift in a certain direction. But that's something that comes with practice. It's hard to do that with internal stresses, but there are a couple of things that you can change in your body as well. For instance, people that eat larger meals are typically able to eat more, so their digestive system is more in tune with handling more consumption and breaking down. Now, we're going to study the body itself, and we're going to be looking at what each of the organ systems and what each of the organs are going to do. And we're going to try to understand what happens when things are supposed to be working the right way. What happens when we put too much stress on an organ or an organ system? How does that affect the body itself? The body itself is going to use homeostasis and various mechanisms in homeostasis to try and maintain that environment. If nothing else, it tries to maintain the internal environment inside of the body. There's a couple of different, um, I guess you can call them mechanisms that help our body keep that homeostasis as well. One of those is called negative feedback, which is kind of like a thermostat, where if you've ever seen how a thermostat works, if the temperature gets too high, then the heat stops. When the temperature gets too low, that's when the heat kicks on. So there's always this fluctuation back and forth and back and forth. And the more money you spend on your thermostat, the more sensitive it is, the smaller that fluctuation is going to be. It's the same thing with our body. Our body has all these systems that in play, and to keep it in check, there's a fluctuation happening up and down. We're interested in seeing how much we can stretch it up and down, or we're also interested in seeing which parts of our body, which systems are very much set in very, very small changes. Small changes aren't typically the best situation because we want to be able to do things, experience life, and that might require us to have additional changes, additional stresses on the body. But we're going to try to understand that as we go through homeostasis as well. Now, I mentioned negative feedback, and this is one of the main mechanisms that keeps the body in a certain at a certain level. The mechanism has two different parts to it. There's a sensor, and then there's going to be the control sensor as well. The sensor is going to detect the change, so it's going to see what's going on, what's changing, but it's going to look on the inside of the body. So it's going to detect the change inside of the body. The control center is then going to cause you to have a response to that change, whatever that is. That response ideally will bring things back to a normal situation. Once that happens, once you're back in the normal situation, that sensor is not going to be activated because there is no sensor anymore. At that point, we can see that the negative feedback is present when the output of the system weakens that original response. That original response is weakened until it's eliminated, and then you're back to homeostasis. So a couple of different examples of it. One that we're going to talk about right now is how the pancreas is going to detect blood glucose in your body. So if the blood glucose is too high, you have too much glucose in your blood, your pancreas is now going to secrete some insulin. Insulin's a hormone that tells your cells to suck up more of that glucose. So if your cells suck up that glucose, now you don't have as much glucose in your body anymore. Or I should rephrase that. You still have glucose in your body, but it's in your cells. It's not in your blood. So your blood sugar appears to be normal, and the pancreas no longer has to secrete that insulin. You got to be careful with this because, yes, your cells now have the sugar, so there's no blood sugar as much in your blood cells or in your blood. But because the sugar is in your cells, next time you ask your pancreas to secrete insulin, what if your cells can't take any more sugar up? So we can't stress the system too much, but just in case we need it, it is there to help us out on some occasions. So we look at a biology example. Sensor starts off over here on the far end. That information is going to go to that control center. That's going to respond with a stimulus, and that stimulus is going to cause an effect. That is called negative feedback. Ideally, we should come back to this balance situation. If we don't have enough, then our scale is tipped off, or we're not at homeostasis. And when that happens, there's going to be another stimulus that's going to trigger the sensor, and that's going to continue on. This cycle continues indefinitely until that homeostasis scale is finally back in balance. So we look at it from a mechanical perspective. I use that thermostat as an example. The way it works is, let's say we set the thermostat to a certain temperature. I know, something like 68 Fahrenheit. I should have turned that into Celsius. I'm sorry. You set the thermostat to 68 Fahrenheit. Maybe in your notes I'll have changed that to Celsius. I can't do it on the top of my head though. And this is the set point. So thermostat has a sensor in it, and it's going to detect when the room temperature gets above or below that set point. It's also going to act as your control center. So when you need to turn the furnace off, if the heat is too high, your control center is going to turn that off when it's too hot. But if the room is too cold, your thermostat is going to turn the furnace back on to increase that temperature. And that's why you're getting that pattern at the bottom. You can see the set point is right along the middle here. And the temperature in the room is going to fluctuate up and down, up and down, up and down. Okay, if we get too far beyond that bottom threshold, we have to turn thermostat on, or we turn the furnace on. If we get above that 70 Fahrenheit threshold, we have to turn the thermostat off. So when the room is off, or when the furnace is off, the room cools. When the furnace is on, the room is going to warm up. So essentially, the negative feedback mechanism here, there's a fluctuation above and below the normal standard. So another picture of what that looks like. It's a slightly more complicated system because there's two cycles that are running at the same time. You'll see the thermostat is all the way on this end here, and we're saying that it's reading at too hot. So that information is going to the control center, which is also your thermostat, and that's going to tell you to turn the furnace off. And that should bring things to a normal room temperature. But if the furnace is off, eventually your temperature gets too cold. So now you get a stimulus going to your sensor in the other direction. It's saying that it's too cold. That's going to go back to the control center. Again, it's your thermostat, and that's going to turn the furnace back on. So then it comes back to the middle here. So you're either working in one of these loops, you're either working in this loop at the very top, or you're working in this loop down at the bottom. But there's that tipping point in the middle where it makes almost a peanut shape or a figure 8 pattern where you go around the cycle and then you start again. And that's how you balance back and forth on this control system. We have one of those in our body also. That is going to be in our brain. It's called the hypothalamus. So the hypothalamus is our temperature sensor. When the body temperature is above normal, that control center is going to direct blood vessels to your skin, and that's going to cause blood vessels to dilate. This is going to allow more blood flow near the surface of the body, and that allows the heat to be lost to the environment. So our skin, the fat in our skin and the flesh of our skin, that acts as an insulator. But if we're too hot, you'll notice that people, you see in the summer a lot, especially if you have fairer skin, after you come inside or if you've gone for a run, your skin might look a little bit rosy. You might have rosy cheeks. That's because your blood vessels have been dilated. They're coming closer to the surface of your skin, meaning you don't have as much insulation. So that heat can be lost from the body. And that can be a good thing because if the heat goes back into the environment, it means that you are now going to start to cool down. We also have a nervous system. It's going to activate your sweat glands. So across your body, you have a whole bunch of these sweat glands, and they're going to release some fluids. Typically, it's a salt water concentrated fluid. What that does is it covers your body in a thin layer of liquid. Water is exceptional at absorbing heat. So if you need to lose some heat, one, you're allowing your blood vessels to come to the exterior of your body, and then the water on the outside of your body is now going to start and soak up some of that heat, and then either the sweat gets wicked off your body, or at least it's out of your body, it's stored out elsewhere, so it's not going to continue increasing your body temperature. So it takes a while, but Essentially, we're trying to keep our body at 37 degrees Celsius. If your body temperature falls below normal, so in the other direction, your control center is going to send the blood vessels to constrict. It's going to cause them to stay closer to the inner part of your body. That's why when you come in on a winter day, your skin might be really tight because all your blood vessels have been sucked onto the inside. That allows for more insulation, so that prevents your heat from being lost. You still lose a bit of heat if you're stuck outside. You can't insulate yourself indefinitely, but it helps your body stay or keep that heat for a little bit longer. When your temperature is going to come back to normal, that control center is now inactivated and doesn't need to function anymore. So same idea as we saw before, but instead of a thermostat, it's your brain. It's your hypothalamus. Your hypothalamus is your sensor and your control center, and that's going to send signals to various parts of your body. So into your skin, your blood vessels, and your sweat glands. And then you're going to either work in this top loop over here if your temperature is above normal. You're going to work with this loop at the bottom if your temperature is below normal. And somewhere in between, you'll make that figure 8 pattern to get back into one loop or the other. We've also got what's called a positive feedback loop. So positive feedback, when there's a change happening, when there's that stimulus and that sensor happening, it increases that feedback, increases that stimulus. An example is the process of labor is going to trigger hormones that cause uterine contractions, and it's going to cause those contractions to increase. Things like blood clotting and stomach digestion is also going to be working with positive feedback. So more of a stimulus causes more of a response until that entire stimulus is gone. A couple of other issues that we can get are things like fever. It can change your body temperature, and because it's a positive feedback, you can cause your body temperature to rise even higher than it necessarily needs to be. It can be okay if you can handle that temperature change. If your fluctuations are higher, that's not such a big deal. But if you're a person who's sick, let's say you're in the hospital, your immune system's down a bit, this is a situation that could be a bit of a problem. So that's why they're always watching out for fever if you ever are sick. I'll show you a couple of other anatomical pieces as well. We're going to talk about the body cavities because we're going to talk about various organ systems. You need to know where those organ systems are located. So our body is a whole bunch of different cavities. These have either organs or some sort of skeletal structure to protect us, or some sort of muscular protection as well. There might be some sort of fat deposits to insulate or protect these cavities also. The whole point of the body cavity is to house these organs and organ systems, but it's also there for that protection piece. You need to be able to function without damaging yourself. So we got a whole bunch of different organs, things like the lungs, the urinary system, the bladder, the stomach. These are organ systems that change size over time, so we need cavities that can accommodate that change. The body itself has 4 of these cavities. I'm just going to move my image here so that I'm not covering up the text. Let's go in the corner here. So your body's going to have 4 of these cavities, and they're going to protect your internal organs. So a quick image of what that kind of looks like. I know it's kind of off center, but we can see what we've got. So right up at the top, you've got what's called your cranial cavity. That's where your brain is going to be held. That spine is going to go through, or your spinal cord is going to go through your spine all through the back. Then you'll see you've got a couple of cavities up in the front of your body as well. This is your ventral cavity. You've got the thoracic cavity, which is up at the top part. That's your chest. That's where you're going to have your heart and your lungs. That is separated by a diaphragm, which is a special muscle we'll see in the respiratory system. But this is separated then from your abdominal cavity. Your abdominal cavity is just below that. And this is where you're going to have a number of your digestive organs. This is where your abdominal muscles are. There's more physical motion in this part of your body. Like you can't really bend this upper part of your body so much, but you can work out, say, this abdominal cavity a little bit more. So a lot of movement in this area, small movement. So your stomach is moving, your digestive tract is snaking along, your bladder is down at the bottom. Whereas you have large movements here at the top in your thoracic cavity where your heart is constantly beating or your lungs are expanding and contracting. If you just wanted them as notes, we got them listed here as well. Cranial cavity, that's got your brain. Spinal cavity, that is for your spine. You'll notice that there are bones that are surrounding your spine for extra protection and support. We've got a wall of muscle down in the middle of our body that is called your diaphragm. So that's going to separate the 2 cavities in the trunk of your body. That is the thoracic cavity up in the upper part. And then you're going to have the abdominal cavity in the lower portion. Okay, so these are just holes, and these holes have various organ systems in them. The other thing you got to be watching out for in biology, and this comes into another topic called kinesiology. So those of you that are interested in going in the medical direction, you have to be able to communicate biology to another person. So we use anatomical terminology. This is terminology that I can identify a body part to any other person who is in kinesiology or anatomy or biology, and I can identify it, and we can talk about the exact same information. For instance, let's say I'm a doctor and I'm dealing with a broken bone in somebody's left ankle. I can look at it, I can do all the stuff that I'm able to do as a doctor, but then if I send that information off to an X-ray tech, I have to communicate to the X-ray tech that there's an injury in the ankle. And so easiest thing is I have to identify, well, it's the left ankle, but where on the left ankle? Which part of the left ankle? I've done all my work to find out and isolate exactly where the issue might be. And then whoever is doing the next job needs that support. They need that information to help themselves as well. So I need to be able to identify the various specifics of the body also. So we're going to use some anatomical positions when we talk about the body to hopefully make sense of the various words that we see. So the first one I'm going to tell you about is called superior. Superior means that this body part is above another body part, or it's going to talk about a part that is closer to your head. So my shoulders are superior to my abdominal muscles. Or I could say my pectoral muscles are superior to my heart, which is deeper in the body. The opposite of that is inferior. Inferior is something that is more on the inside of your body. So that is either inside or it's closer to your feet. So my knees are inferior to my pelvic bone. Or I could say my heart is inferior to my sternum. Sternum is my breastbone up at the front here. I've also got this word called anterior. You might have heard of anterior when talking about like old historic British or even Roman homes. They call it an antechamber. Antechamber is that front space at the beginning of a house. So when you first walk into a house and you might take off your shoes, that could have been referred to as an antechamber before. For a body, it means towards the front. So if I say there's an injury in someone's ankle and it's in the anterior part of their left ankle, it means it's the front part of their left ankle. So it doesn't matter how that person is standing. As soon as they see anterior, they know it's somewhere on the front. If I say ventral, I could also be talking about the front. We use that in biology sometimes. So you need to recognize that both anterior and ventral both mean the same thing. There's also the opposite, which is posterior or posterior. Posterior means towards the back. So the back end of your body will be posterior. So the injury is in the left ankle, but it's in the posterior side of the left ankle. I know to look at the back of the left ankle. Dorsal is also the same thing as posterior. So anterior and ventral go together. Posterior and dorsal go together. It's just two various terms that we use. It depends on where you are in biology. If you're talking about human health, you might use ventral and dorsal. If you're talking about just general location, you might use anterior and posterior. But those terms are all interchangeable, so it's ideal to recognize what each of them means. It also means that memorization is probably not going to help you out so much. You need to recognize what these mean. We've also got this imaginary line that we draw through the body. So right down the middle of the body. I know it's not really easy on the camera. So right down the middle of the body, if you imagine imaginary line that cuts you in half, so you have bilateral symmetry. We call this towards the medial, or the median. So the medial is going to relate to this midline in your body. Things like my nose are medial to the eyes. So my nose is more towards that midline than my eyes are. Or my sternum, again, my breastbone, is more medial to my shoulders. Or my collarbone, my clavicle, is more medial to my humerus bones. The opposite of that is lateral. So lateral means moving to the side, away from the midline. So I'll say that my right metatarsals are lateral to my abdominal muscles. So metatarsals are the small bones in our limbs. Or my ears are lateral to my eyes. My ears are more away from the midline than where my eyes are. So that is laterals away from that middle point. We've also got proximal. Proximal is closer to a point of attachment because we have limbs, right? So I've got a shoulder over here. My shoulder is attached to my arm. So what is closer to that middle part? I can talk about, say, my elbow is more proximal than, say, my wrist, because my elbow is closer to my shoulder than my wrist is. So elbow is proximal to the wrist. Didn't realize that was the example coming up. The opposite of that is distal. Distal is the opposite of proximal. So if I'm talking about a body part that is away from that joint, so I could say that my ankle is distal to my knee because my ankle is further to my pelvic bone than my knee is to my pelvic bone. My pelvic bone is where my leg, my limb, attaches to the main part of my body. So fingers are distal to the wrist. Fingers are also further away to my actual body than my wrist is. I've also got this word called superficial. It means situated near the surface. Superficial helps us identify things things like certain pains. So sometimes when someone gets injured, they might be hypersensitive. And hypersensitive means that even if you very gently touch part of their body, they feel an extreme amount of pain. And that means that there is some sort of superficial pain. Somewhere near the surface, something is causing that pain. The opposite of that is going to mean, so the peripheral. The opposite of that is deep. If something is more internal, we describe that as a deep pain. So if you've ever had, say, a twisted ankle or a sprained ankle or a wrist or something, you went to the doctor, they might ask you where you feel that pain. Are you feeling it towards the outside or towards the inside? And then when they write their notes in your medical file, they're going to say, oh, well, this person had an injury that the pain was deep in their wrist. That means there's something deeper inside of the wrist as opposed to something that is more towards the outside. Because in anatomy, there's so many moving pieces that we need to identify specifically what those pieces are. We've also got this word called peripheral. Peripheral is similar to superficial. It means closer to the surface. And then we've also got deep, which would be the opposite of that. The cortex is the outer layer of an organ. Some of our organs actually have parts that are called cortex because it's the outer part. So if you're talking about a specific organ, and I'm interested in the outer part of that organ, I'm going to call it the cortex. And the inner part is going to be called the medulla. And again, there's going to be some organs that have that name. They'll have the word medulla right in their name because they're talking about an inner part of an organ. So we're going to see that a couple times. We'll see medulla pop up twice at least, once with the urinary system and once with the brain. We'll talk about anatomical position in class as well. Anatomical position, in case you're wondering if you're not in class or something, is if a person is facing you. So any patient, they must be facing you. Their palms are open and by their side. If I stand up, I can show you what that looks like. That's a lovely sound. So anatomical position is when they're standing, arms by their side, open. My palms are open. I can't really get that in frame, but they're facing you. Whenever we talk about any sort of medical issue, we're talking about anything in medicine, we're talking about a human being, we need to have them in anatomical position so that if I give my notes to another doctor, they can see the exact same image as the first one. If you ever go to the doctor and you have an injury, they'll have a picture of like a skeleton, but it's in anatomical position, and they'll circle a part of the body that they're interested in. Anyways, that's going to conclude our notes on homeostasis and wellness. So you've got an assessment coming up on that in a little bit. But after that, we're going to continue on with the digestive system and a little bit of information on nutrition as well.